The main question we're getting at the office is about the J&J vaccine pause and its side effects. Questions are, my 18-year-old son or daughter got the J&J vaccine last week. What should we do? What is okay to do and not to do? Should we give them aspirin? That's the topic we're going to be discussing today. I am Dr. Noha Polak from Progressive Pediatrics in Union City in Bayonne, New Jersey, where I've been practicing pediatrics for the last 18 years. I have been giving messages weekly, and many of them were about the COVID-19 vaccines. This week, the vaccine that has been paused is only the J&J vaccine, not the other two. So what did I learn so far about this pause? Number one is that the main side effect has happened in 6 women out of 6.8 million doses. So this rare side effect is 1 in 1 million, or actually less than 1 in a million doses of the J&J vaccine, not the other 2 vaccines. The side effect is a blood clotting problem, and it has only been so far reported in women between the ages of 18 and 48. And it happened within the first 2 weeks after getting the vaccine. This blood clotting event is extremely rare in the general population, and it's also rare after getting the COVID-19 vaccine by J&J. So the question that was asked of me yesterday is, my 18-year-old child got the J&J COVID vaccine last week. Should I give them aspirin? The answer is, please do not give them aspirin. That is not recommended at this point to help prevent this kind of blood clot. It is not a regular kind of blood clot, and so we do not recommend that you give aspirin at this point. If that were to change, I will let you know as soon as possible. What if your child or you have gotten the J&J vaccine much earlier, like months ago, etc.? So this rare side effect is an autoimmune side effect, and it only happens so far in the first 2 weeks after the vaccine. So I just want to give you a couple of main messages. The J&J vaccine and the AstraZeneca vaccine that's being given in Europe are both adenovirus vector vaccines. So they are not similar to the vaccines given by Moderna or Pfizer. And they have a different way of priming the immune response. So this side effect has so far been with only J&J and the AstraZeneca vaccine. And whether it's exactly the same mechanism of action or not is still being studied. We don't know the answer to that yet. So is it likely that if you have gotten, or your child has gotten, a Pfizer or a Moderna vaccine, that you could also have blood clots? Out of the many, many millions of vaccines given that were made by Pfizer or by Moderna, no one has developed blood clots so far. So let's allay some fears here. Number one, the chances of a person who has gotten the J&J vaccine getting a blood clot are less than 1 in a million. Number two, these side effects are only in the first 2 to 3 weeks, not long-term side effects as far as we know. We're following that closely. What should you look out for if you or your child have gotten a J&J vaccine in the past 2 to 3 weeks? Number one, headaches. Number two, severe abdominal pain. Number three, bruising, chest pain, or leg pain. So once again, severe headache, severe abdominal pain, bruising, chest pain, and leg pain. Shortness of breath as well. If you have gotten the vaccine in the last 2 to 3 weeks and you have those symptoms, call your provider right away. There are blood tests to help diagnose this, and there are treatments for it. So just let your provider know. If it is something very severe, of course, go to the nearest emergency department. The recommendations so far are not to take aspirin if you've gotten the J&J vaccine to prevent blood clots. Those are the recommendations because it's a different type of clotting mechanism. So the labs that we can do in the office, or we can order from the office, is called the CBC to check your platelet counts if you've got symptoms that are minor symptoms. But if it's severe symptoms, we're going to ask you to go right to the emergency department to assess the situation. Once again, the Pfizer and the Moderna vaccines are not related in any way to blood clotting, and they are not having the same mechanism of action. It's only J&J. So I am Dr. Noha Polak from Progressive Pediatrics, where I would love to answer your questions. If you are a patient and you're concerned or you have questions about anything, please call us. We will answer your questions. If there is any concerns for any health concerns at all for you or your child, call us and we will answer them, or we will see your child in the office. As you know, we're open 7 days per week in Union City and 5 days per week in Bayonne. And we love to see you and your children in person or via televisit. Share this video if you have a moment, and we are here for you every day. Have a wonderful day. Bye-bye.